start a series called Why We're Different, and I am going to start highlighting some of the things that we do differently compared to other offices. Starting with number one is the initial intake and consultation process. I think transparency is super important when it comes to all things healthcare. So from a very beginning standpoint, all of the prices are online. You can submit for a photo review by me, where you send in some photos, you fill out a medical history form, and I personally will review all of that information, and our office will give you feedback on what I think you could consider surgically. At that point, to see the price it is, there's no hidden fees or anything like that. From that point, you can schedule a consultation with our team. That consult is usually scheduled several months in advance. Currently, we're scheduled about 6 months out. I know it sucks to wait, but that's just kind of the volume that we are incurring. Those consultations can be done in person or virtually. I personally prefer if you're able to come into the office. A lot of people will fly in for that initial consult, which is great. That consultation is about an hour and a half. The first hour was with me. We sit down together, walk through your photos, walk through your concerns, your goals. We review your health history to make sure I didn't miss anything in the intake form. We talk about which procedures are of consideration for you, what I think that will get you, expectation and result-wise. We talk about where the incisions are, all of the risks involved. I try to show you pictures of other patients that are similar to you, both in terms of anatomy, age, gender, to give you a sense of what I've done in the past for other patients. I'm an open book during that consult, so you can really ask me any question you want. And then after I'm done, which usually takes about an hour, you meet with one of our patient care coordinators. They are the logistics person, so you guys can talk about calendar, surgical dates. Sometimes we have some homework before surgery. If you have like chronic medical conditions, they help ensure that we've got everything we need prior to surgery.